I'm Brandy.
I'm Brooke.
We are nurses at Blue Cross and Blue Shield of Louisiana, and we're dedicated to OGB members.
I'm stationed at the Daletown State Office to serve members in the Baton Rouge area.
And I see our members in the local hospitals and facilities. There are some good reasons to work with a health coach.
Members who talk to a health coach are 65% less likely to be admitted to the hospital.
We help you make small changes to meet your health goals.
We can also help you save money on certain medications.
There's no cost for working with a health coach. It's part of your benefits.
If you think we can help you, give us a call today. I'm Brooke. I work with OGB members downtown in the Baton Rouge office face-to-face.
And I'm Brandy. I'm also a health coach at Blue Cross. I work with our members in the facilities here in the Baton Rouge area. You may see me in some of those facilities. So, Brooke, tell us about care management.
Yeah, you might not know that Blue Cross has over 300 nurses dedicated to help you, support you for any of your health conditions. Members that are enrolled in care management are 65% less likely to be admitted to the hospital. And we can also help you save money on some of your medications.
Great. We also have medical directors, dietitians, social workers. We have lots of healthcare staff here ready to assist you with your healthcare needs. So, what about disease management? Can you tell us about that?
Yeah, disease management, it's 5 chronic conditions that would qualify you to enroll in that. COPD, asthma, diabetes, heart disease, or heart failure. You'll have a nurse assigned to you, and she'll call you periodically and check in and help you with any health goals, coordinate care with your doctor, keep you compliant with your medications, and you would get a discount on certain medications.
Okay. Yes. Some of those benefits include the individual support, listening to the members' concerns. Mm-hmm. We also help educate them on their medications, help them coordinate appointments with their doctors, find in-network providers.
And working on any health goals, compliant with medications, just sticking to your doctor's treatment plan, staying active. Basically, whatever you need support with, we're there to help.
Yes. Also, connecting you with all those other healthcare providers. We have the dietitians and social workers. We can also help coordinate care. If you need any kind of DME, durable medical equipment, we can assist you with that. We can help you get in with outpatient therapy or home health if that's something you need. Those are all services we can assist you with.
Yeah, and if you're ready to enroll, you can reach us at 1-800-363-9159, Monday through Friday, 8 to 5. We also offer case management. Can you tell us a little bit about that?
Yes, so our case management program is for those members who have other complex medical issues going on, such as high-risk pregnancy. If you're having a lot of issues with your pregnancy or anything that deems you high risk for that.
Depression, obesity, if you've been in a major car accident and you've broken bones and you need outpatient therapy, any complex medical issue that you need support with, we can help you with that.
Yes. Also, rare diseases that are not as common, we can also assist you with that. We have the same benefits as the case management program as our disease management program. So we can reach out to you for that as well. And again, give us a call, 1-800-363-9159, Monday through Friday, 8 to 5 p.m.
You may be wondering what it's like to talk with a nurse. Brandy and I will go over some of those questions now.
So as a nurse case manager, I would come into the facility and see you, or if you meet with Brooke downtown, you see her face-to-face, or you would get a call on the phone from one of our nurses. And I would start out introducing myself as a nurse case manager from Blue Cross Blue Shield of Louisiana. And I would educate Brooke on the benefits of our programs. And then I would start asking a series of health questions, such as who her providers are, how often she goes to the doctor, if she has certain chronic conditions, if she is dealing with any other issues in her life, such as social, mental health.
If you've been to the emergency room lately or been admitted to the hospital,
yes.
If you're having any pain, any barriers to your health, any transportation problems, any trouble getting your medications.
Yes, we would ask you all those sorts of questions and assist you if you have any needs, such as discounts on medications or helping you find a provider in your network. We could also assist you with any services you may need.
Coordinating DME, any outpatient therapy, whatever you need. We also can help you set a healthcare goal.
Yes, healthcare goals such as staying active, doing the treatment plan that your doctor has provided for you. Also, discussing your medications, making sure you understand the medications that you are taking, any side effects you may be having. Also, the frequency you should be taking them and why you should be taking them, as well as any lab work you may have had that you may have questions about. We also have educational material we can email you or send in the regular mail to just offer additional support regarding your health condition.
We make sure to address any care gaps you might have, such as your yearly mammogram, pap smear, colonoscopy, anything to improve the status of your health or to maintain it.
Yes, and also specific to your condition. If you have diabetes, for example, you would need certain blood work, making sure that you have that blood work done periodically for that specific condition. Cholesterol, blood pressure checks if you have high blood pressure or heart disease, weighing yourself if you have heart failure. All those questions that you and your doctor may be discussing, we would just kind of reinforce that treatment plan and help you understand the treatment plan a little bit better.
Yeah, an extra support. You know, you have questions sometimes when you leave the doctor's office that you don't think of right away, and we'd be here to assist you with any of that.
Yes. We can also help you come up with questions to ask your doctor, help you make a list of the things you're concerned about regarding your health, and help you talk with your doctor about those things so that you're more prepared for your appointments.
Yeah, and if you're ready to enroll, you can call us at 1-800-363-9159 Monday through Friday from 8 a.m. to 5 p.m.
So that was a lot of information. We'll go over a specific scenario such as diabetes. So if a member called in and has diabetes, there's specific questions we ask related to your A1C blood work. If you're checking your glucose at home, what type of meter you have. If you're getting your feet checked from your doctor.
If you're getting your eyes checked for diabetic retinopathy, compliant with all of your medications and your doctor's treatment plan. Also, being aware of any signs or symptoms of low or high blood sugars.
Yes, and how to manage those high and low blood symptoms, what to do in those scenarios, when to call the doctor, when to go to the emergency room. Also, following up with your provider periodically, keeping a log of your blood sugars to make sure that you can report those back to your doctor.
Or if you need to speak with one of our dietitians, we can also set that up for you.
Yes. Also, if you have any mental health issues, stress going on in your life, we do discuss that as well for diabetics because that can also affect your blood sugar.
Another condition we go over with our members is heart disease. For example, if you have heart disease, we talk about medication compliance.
We talk about getting your cholesterol checked, making sure your blood pressure is monitored at home. You keep a log of that to give to your doctor, and going in to get it checked by your provider and making sure your blood pressure cuff is accurate as well.
Going over signs and symptoms of hypertension, high blood pressure. Have you had any chest pain, blurry vision, shortness of breath?
Dizziness, lightheadedness, headaches, any of those symptoms that you may be ignoring that you may want to call your doctor about or notify your physician so that you can make sure your medications are working the way they're supposed to be working.
Or on a heart-healthy diet. Dietitians can also help you with that.
Yes.
Being active, low sodium.
Staying active, all of those things to help you manage your heart disease. We also talk about the risk factors that heart disease can also lead to diabetes and vice versa. So those all sometimes go along together, and you need to be checked for all of those things from your doctor to make sure you're good. We also go over heart failure with a lot of our patients.
So we'd make sure you were weighing yourself daily, following any fluid or salt restrictions.
Yes.
Looking for swelling or edema.
Yeah, measuring your fluid intake if you have a limitation on that, measuring your salt intake if you have a limitation on that, reporting those symptoms to your doctor immediately because that is a sign that your heart failure is exacerbated or flaring up and could lead to preventing a hospitalization or emergency room trip.
And just like with heart disease and diabetes, they go hand in hand as a comorbidity. So you want to be aware of all of those possible outcomes.
Yes, as well as we also talked to members about asthma and COPD. Those are lung conditions, and medication compliance is also very important.
Your pulmonary function test, being aware of any signs of an asthma attack or COPD exacerbation.
Yes, having an action plan, monitoring those things that may trigger your asthma, such as heat and cold affect people differently, allergens, dust,
pet dander.
Yes, all of those things can greatly affect your asthma, and noticing and recognizing those symptoms before they get too severe and you have a full-blown asthma attack.
If you're ready to get started, you can call us at 1-800-363-9159 Monday through Friday, 8 to 5 p.m. If you don't qualify for case or disease management, you may qualify for our other wellness programs. Live Better Louisiana is a program that can help you make better health choices, offer you resources for your health. All active members are eligible for Live Better Louisiana.
Yes, so take a look at the video to learn more.
Live Better Louisiana is OGB's game plan for better health. It is sponsored by the Office of Group Benefits and Blue Cross and Blue Shield of Louisiana at no extra charge to OGB members. In fact, it can save you money. All primary members with OGB Blue Cross health plans are eligible for a Catapult Health checkup through the Live Better Louisiana program. This applies to both active and retired members. Members of OGB's Medicare Advantage Employer Plan are not eligible. What do you get for taking part in Live Better Louisiana? If you complete your Catapult Health clinic checkup or get a checkup with your primary care doctor and have them completely fill out the PCP form, you can earn a $120 a year credit on your OGB Blue Cross premiums for the next plan year. The Live Better Louisiana program starts with a no out-of-pocket preventive health screening from our partners at Catapult Health. I'll let Tara with Catapult Health tell you more about the checkup.
Across the nation, Catapult Health is revolutionizing preventive medicine by bringing personalized checkups to the workplace. We are a medical provider, offering lab-accurate blood work done in real time. Our nurse practitioners consult privately with every patient using advanced video technology. It all starts with a simple consultation. First, we perform diagnostic blood tests with only a finger stick. We process the results immediately and securely transmit them to each patient's smartphone, primary care provider, and their patient portal.
In comparison to an appointment with a regular doctor, it was a lot easier instead of having to wait a couple of days to get your results.
We use these results, combined with physical measurements like blood pressure, to assess each patient's medical condition and identify their health risks. Every patient meets the board-certified nurse practitioner like me using secure video technology.
Good morning, I'm Amanda Hall. I'm a nurse practitioner with Catapult Health.
Together, we review family history and medications, diagnose new conditions, and create a personalized action plan.
Clinics are scheduled across the state. You can search for a convenient location by visiting the scheduler at timeconfirmed.com/OGB.
So the new program year starts October 1st and runs through September 30th of 2024. You can learn more at Live Better Louisiana at bcbsla.com/OGB. Select your health plan and click Wellness. And while you're there, you can also go to our Care Management tab, and you can learn more about the Diabetes Prevention Program, OMADA, and the Diabetes Care Program that's sponsored by our Pharmacy Benefit Managers, CVS Caremark.
Thank you for joining us to learn more about our wellness programs.